Hi, podcasters. Welcome back to Skin the Surface. On today's episode, we will discuss the topic that is on all of our minds right now, and that's the COVID-19 virus. Keeping things skin relevant, we will discuss the impact that these unique and unprecedented times have had on our skin. We will discuss what we know so far about the skin manifestations of the COVID-19 virus and what you can look out for. We also will discuss what to do about skin irritation from frequent hand washing. For any non-skin related information, we recommend visiting the Centers for Disease Control and Prevention website at www.cdc.gov.
Impacting more than 180 countries, we all remain in shock about the impact of a viral infection, COVID-19, a new strain of coronavirus, on our personal lives, the economy, and of course our health and the health of others. COVID-19 is a respiratory viral illness that was first identified in China. This virus is typically spread from person to person through coughing and sneezing. It may also be spread through infected surfaces or objects. Although coronavirus has been around for many years, this current outbreak is due to a new and highly contagious strain of the virus. We are still learning so much even now on how this virus is spread and how fast it can be spread from person to person. And the recommendations from our infectious disease colleagues appear to be changing day by day as new information is gathered. For the most up-to-date information, we recommend visiting, as Mary mentioned, the Centers for Disease Control and Prevention website at www.cdc.gov.
So as we mentioned, today's focus will be on the skin manifestations of COVID-19. On that note, can those who become infected with COVID-19 develop any skin rashes? Well, the answer is yes. Initially, we thought that the rate of skin rashes from COVID-19 infection was low. However, as more and more data is being reported throughout the world, we're learning that skin rashes may be more common than we initially thought. So what kind of skin rashes are people experiencing?
Well, Mary, a lot of this is new and emerging, and the information we are about to present you is still being even evaluated today. There is a small study taken from Italy looking at a group of 88 individuals infected with COVID-19. In that group of 88, about 20% of individuals had some skin manifestation of COVID-19. The most common was a diffuse red rash, followed by hives, and even a case of a chickenpox-like rash. The presence of a rash was unrelated to the severity of the COVID-19 infection. In another report taken from Thailand, a patient presented with petechiae, or tiny bruises, as the primary symptom of his later confirmed COVID-19 infection. Several other individual cases in the United States have shown similar skin rashes that may actually be related to an underlying blockage of small blood vessels, either from a clot or another inflammatory reaction. Physicians are still trying to piece together this information and understand the underlying mechanisms that are causing rashes in COVID-19 patients.
So what happens if you experience any of these mentioned skin rashes? Well, we recommend that you discuss with your primary care provider and your board-certified dermatologist for the further steps. In general, if you're feeling well enough to manage your symptoms at home, it's generally recommended that you stay home as opposed to potentially exposing yourself and others should you go to the emergency room. Since we currently have a shortage of testing nationwide, it's important to reach out to your local or state departments for further guidance regarding testing and whether this is an option for you. The most important thing that we can do as a community is to take an active role in social distancing. Avoid heavy public areas and stay at least 6 feet away from those around you. It's extremely important. Not only protect yourself, but also your family and other members of your community.
Exactly. And most importantly, remember to wash your hands frequently with soap for at least 20 seconds. Believe it or not, and I'm just learning this myself, 20 seconds is actually a very long time. I kind of remember washing my hands by singing the happy birthday song twice or singing the Queen song, we will rock you 3 times.
Speaking of hand washing, I don't know about you, Rina, but my hands are super dry and cracked, and my hand eczema is flaring. For anyone who's experiencing this as well, we have some helpful tips to share. So tip number 1 is to moisturize every single time you wash your hands. Many of us are using antibacterial gels and soaps, hand sanitizers, and hot water to prevent the spread of the COVID-19 virus. Antibacterial soaps and hand sanitizers have a really high concentration of alcohol, which, as you can imagine, is great in killing germs, but also can strip the natural oils and moisturizers right off your skin. Moisturizing our hands is super important for a variety of reasons. Dry, cracked skin can actually make it easier for bacteria and other viruses to get inside of our body. Dry skin can also cause eczema and other skin rashes to flare. So by applying a hand moisturizer immediately after hand washing, this helps lock in moisture and reestablish a protective skin barrier. For those who don't mind having that greasy feel, you want to opt for an ointment. Ointments are things like Vaseline, Aquaphor, and even CeraVe has a healing ointment. If you prefer a less greasy option like myself, then you want to opt for a cream. A few that I recommend for patients are Neutrogena Norwegian Hand Cream Formula, and then also the La Roche-Posay Lipicar Balm. For the best results, you want to apply these moisturizers, like I mentioned, every single time you wash your hands. But it's also a great idea to apply them at night. You can put a thick layer of the moisturizer on and then put on a pair of either white cotton gloves or even white socks to really seal in that moisture.
With so many products on the market, a second helpful tip is to really look for hand creams or ointments that come in a pump bottle or tube that you can squeeze out very easily rather than a jar, as this is more hygienic and it can help you avoid spreading germs from yourself to someone else in your household or vice versa. And finally, tip number 3, it is really important to use a hand cream that is fragrance and dye-free, as these are less irritating for your skin. I often recommend in my patients to avoid creams and lotions that contain numerous botanical or natural ingredients, as these can be very irritating to the skin and actually may worsen skin rashes and eczema. Well, that's all we have for today. As each week unfolds, we are presented with even more information regarding the COVID-19 virus and its effects on the skin. We will work together to keep you updated with the essential information you need to know about your skin as this continues to unfold. Continue to check out our website at skinthesurfacepod.com for additional updates, blog posts, and new developments. Stay safe, podcasters, and most importantly, stay home.